Yeah, well, this is Tim Thomas, and I'm currently a consultant, healthcare consultant, and I've got about 35 years in healthcare financial management experience, everything from CFO to CEO to project development. My experience with rural community hospitals is that we all do infusion. Generally, it's done in the emergency room setting. Sometimes some IV therapy is done in the clinics as well. None of it is a structured separate service line. It's generally a service that I would say that the emergency room department or the clinic is somewhat compelled into doing. Generally, they prefer not to. I think they get a doctor's order and they're stuck with doing it. And there's not a lot of systematic procedures in place to handle infusion patients. And because of that, I think that to a certain extent, the quality of service is lacking. And more importantly, the case management and the reimbursement elements to get properly paid are missing as well. So that's why when you look at infusion programs, most of the hospitals do not look favorably on it, in terms of where they're at with their infusion program. I specifically ran into that at one hospital where we had an infectious disease doctor in a tertiary market next to us that was seeing a lot of patients, and he was ordering a lot of infusion for patients in our community. And we just simply were not able to handle them, or if we did, we were doing a poor job at it. And so we tried to implement, an expanded infusion program to accommodate that specialty physician referrals, and basically just had to kind of get back after a while that, we really weren't able to handle those infusions in our community. And he was also in agreement with that because of the quality. So our patients were having to continue to go to that tertiary market to get infusions. And that's when I ran into Mitchell at Community Infusion Solutions at a conference, and he was marketing an outpatient infusion program. And jokingly, I said, well, I'm not sure how you do that because we tried that and we couldn't get it to work. And he said, well, we've been successful at it, and if you're interested in giving it a try, I said, yeah. I mean, I basically said, sure. I mean, it was a no risk evaluation on our part. He did all the analysis and so forth. And frankly, I was not expecting, a whole lot of success in being able to do it. But, he put the program together and we implemented. The implementation, cost was minimal. All we had to do was buy a few infusion chairs, and we took an existing patient room and converted it. And so we were on our way. And they were just incredibly successful with it. And within 3 months, we were generating $75,000 to $100,000 collections, and our expense was, less than half of that. And that was the beginning of a very successful program with Community Infusion Solutions that still currently is in place. We did start seeing some spin-off referral activity coming out of the Community Infusion program, because it was the first time, for the most part, that we marketed, and I'm not going to say we, Community Infusion Solutions, with our marketing team too, was going into tertiary markets, as far as 75 to 100 miles away. And, we really didn't know that we had patients going that far for specialty care. And they were. And they would go to those places and see those physicians, and they would often need, infusion, but they'd also need other types of services. And once the specialty providers knew that we had an infusion program, they saw us as a referral outlet for them and for their patients that lived in our markets. And, and they would continually just, evaluate whether or not we had other programs. And they would ask us if we did this or if that. And once they built a relationship with us, we were able to, communicate our full array of services. And we started getting referrals for wound care and pain management and just other services in general. Well, Community Infusion Solutions does provide those level 1, level 2 analysis, which, of course, are, projections. And so you do have a basis to go forward, which a lot of times when you're opening a new service line in a rural hospital, you don't even have that. I mean, it's best guess. Secondly, it is a minimal initial investment. I mean, like I say, generally, if you've got a patient room and it's available and you can put a couple IV chairs in there, you've already got IV pumps, you've already got nursing staff. I mean, you really can get into an infusion program very, very inexpensively. The only thing of any significant amount is the implementation fee that would be required from CIS. But even that, is very moderate compared to investing in other types of service lines. And most service lines require, expensive equipment or multiple level of labor resources and so forth. I think the simplicity of the infusion program also makes it an excellent opportunity for a hospital to evaluate, investigate, and hopefully at least implement and see if it'll work in their hospital.